We've been working together in partnership, CNWL and Chasing the Stigma, for a number of years now. And we've done amazing work in training people, using the Hub of Hope, getting out into the community. And we were having a real sense of true partnership together, where we could collaborate and we could work together and we can think a little bit differently. So I was really excited when we initially had the conversation about what else could we do that could really help the community and hit a lot of the things that you wanted to deliver as a trust.
And I think that's really worked well for us, because we have quite a kind of generic approach to our buildings, and we wanted something that looked and felt different. And that's where you were able to sort of advise us from other projects you've done before, but also your ideas of what would work and what wouldn't work. And I think it's really, paid dividends.
As the operators of the Hub of Hope, which is the biggest directory of mental health services in the country, we were seeing how many people were looking at the voluntary sector for help and support. And I think historically there's probably been a divide between NHS and statutory services and voluntary sector. And for me, what was so refreshing when we initially had the conversations was that there was an absolute desire from CNWL to work with the voluntary sector and to create a space that could really integrate both sectors together.
And I think that's really worked. And one of the really exciting things with the workshops we were having was different voluntary sector groups were coming together, and they were collaborating, and they were saying we could run a group together. So say, for example, we had Help the Aged and the Listening Project, saying, why don't we do something together around bereavement, say, for elderly people? And that's something that doesn't normally happen, because everyone's got their silos. So I think this is a forum where we can actually really foster that kind of cross-pollination between organisations.
We have a good community and a reach to a community where we could go and we can ask them and we can try and create and replicate what the community wants and put it into this space so it actually feels like their space. And that was a role that we took really seriously, in going out, speaking to people and finding out what they want to feel represented in this place.
Yeah, and the feedback's really underlined that, because people have said it feels like a really special space. It doesn't feel like they can't believe it's in this building, because it feels so different from the rest of the building.
One of the most special moments really for me is hearing people's voices in this space, seeing people use this space and getting a reaction from people that actually it is a space they feel comfortable in, a space that they feel represented in, and a space that they actually have wanted. And at Chasing the Stigma, lived experience is so important to everything that we do. We want to do things in a way that maybe appeals to people in a different way, appeal to people who maybe would never usually engage with mental health services, people who maybe would never engage with NHS mental health services. And so we wanted to have an approach where we could turn an NHS space into something that really didn't feel like an NHS space.
And I think that's so important, because around the time we were developing the model, I just by chance was talking to a young woman on a food stall when I was out and about. And I told her what we were doing, because I was really excited about it. And she said, you don't know what a big step it is for someone to walk through the doors of a hospital and ask for help. And it actually puts people off. So we wanted to do the opposite, really, somewhere that was welcoming and, where people felt really happy to walk into. And I think that's what we've achieved.
We wanted that spirit of connection and for the community to really feel like this is something that they belong to. We've talked to the community throughout. We've had so many meetings and groups and focus groups and research, and to have what we've got now with the mural on the wall, with the artwork, the way that we've designed it, the way that everything has been done, there's a real sense of Westminster within the space, isn't there?
There is. And I think what's really exciting is it will develop even further. As the groups that use the space want to personalise it and put their imprint on it, it will really start to embody the local community even more. As a trust, what we hope it will achieve is to really blur the boundary between mental health NHS services and the community. I think there's a big gap, and it's a massive leap to go from the community into an NHS facility. So this gives us an opportunity to host services that are more approachable, but recognising that some people's level of need may be greater than that. And then having come here and found it really accessible, they might then feel more able to seek help.
We see our role as that bridge. And I think that creating a space like this is the perfect bridge to integrate different types of services, to appeal to different types of people, and essentially allow people to find help much, much earlier that is right for them.